We're here to talk about one of the most important issues we address in our book, Prevent, Survive, Thrive, Every Woman's Guide to Optimal Breast Care. Now, we know that mammograms are extremely effective in detecting small cancers in women who have a normal exam, and we basically recommend women start at age 40, do it every year, and keep doing it as long as they're healthy. And in doing this with modern mammography, we've dropped breast cancer mortality almost in half. But we still know that we need progress. We know that there are cancers that show up between mammograms. We call them interval cancers. And that's a real bugaboo for us because we oftentimes don't detect them until they've grown quite large. So one of the challenges is to find those small cancers before they show up. And what we found is that the way to do that is to, first of all, on the mammogram, to identify the women that have dense breasts. Dense breasts are primarily white, and cancers tend to be a white dot or a white smudge on the mammogram, but they can blend in, whereas on a fatty breast that's black, these new cancers show up very obviously. So our challenge has been to get women that have dense breasts to do added screening. If they're average risk women, we simply do a whole breast screening ultrasound. And we know that we at least double the pickup of small cancers if we do that kind of aggressive screening. So today we have an opportunity to hear a very special story, one that you just have to listen to carefully, but I know this story will open up your mind about the importance of added imaging for women who have dense breasts. So Donna, you're the one. You've been followed for years at our office, isn't that correct? Yeah, and you've always been good. You've been regular. You've come in, and we've noted all along you had dense breasts, but it wasn't until, was it 3 years ago that we did our first?
Yes, 3 years ago when the ultrasound became available.
So what did you think when I told you about an ultrasound and doing another doggone test? Will you have mixed emotion about it, or did you feel optimistic? Oh, maybe this could be helpful.
I was optimistic. I always feel that you're best to always take advantage of all the screening that's available. And you telling me that a dense breast, you just want to make sure that you're getting all the proper testing that you need to have done.
It's interesting in California where it's a law that women are supposed to be told the status of their density, and if they're dense, they're supposed to be told that they could do extra imaging that would maybe pick up a cancer that was missed on the mammogram. Less than 1% of all the women who get mammograms in our county are actually told, with dense breasts, are told that they need additional screening. So fortunately, you were followed in our center where we're very aggressive about following early detection guidelines. So I think the conversation probably went something like, here's a new test, we think it's very effective, and we would encourage you to do it. And then you went ahead and did it the first year, and then the second year. Mm-hmm. And then what happened on the third year?
The third year, I had my mammogram, and you always do the exam. Then I came back a week later, did my ultrasound, and then I got a call that I need to come back. They wanted to check something, and so I did the second ultrasound, and they found a lump.
Right, so they found in the upper outer kind of an awkward area in the left breast, they found this area that looked somewhat suspicious. And so what did we told you then? To get a needle core biopsy.
Correct.
And we did that, and that probably wasn't a lot of fun, but...
Well, it was necessary.
It was necessary,
that's what we did.
Did you have any problems with it, or did it?
No, no problems with it.
Okay. So most of the time with the ultrasound guide, it's usually pretty easy. We can put a lot of Novocaine in. But at any rate, it comes back benign. Mm-hmm. So I thought, end of story. But the radiologist came over to me, Dr. Barashi, and says, I'm not comfortable with this. I'm not so sure we sampled it adequately. She says, I think you ought to take her to the operating room and take this area out.
Right.
Well, I don't like to make that phone call. Here you did what you needed to do, and we call it discordance. It didn't show what we expected it to show. Mm-hmm. So we had no choice really but to do an open biopsy. And you were really good about it. I remember we went in there, we took it out, and what did we find?
On that
open biopsy, that's when you had your cancer, right?
Right.
Yeah. So she had a small invasive cancer, and it looked like something we could just do a lumpectomy and radiation, just do an outpatient, basically procedure, and expect a high probability for cure. So it appeared that the screening ultrasound saved your life. And you remember what the next test was, or how did it go for the next step?
After the lumpectomy.
After the first surgery, yeah.
Okay, we did another MRI,
That's right, because there was concern at this point that, my gosh, it was so difficult, and we're talking about doing a cancer surgery on one side. Maybe we better do another test that's even more sensitive to pick up small cancers. And of course, we did the MRI, and it shows what looked like a very suspicious lesion on the right breast.
Correct.
And so, how did you feel when you got?
Well, I was very surprised because there's no breast cancer in my family. So,
Well, that's a really good
so that
point.
was a very big surprise for me.
Yeah, your only risk factor was that you had dense breasts, and there is kind of a different sort of opinion among many physicians about this. And most of the physicians that when I read their response to the issue of aggressive screening in women with dense breasts, say, well, we think it's only advisable for women with a strong family history or have other risk factors. And in your case, you didn't have any of those. And I feel strongly that you don't have to have high risk factors. You can still get breast cancer. And I think that any woman with dense breasts should at least consider having the additional screening ultrasound. Now, if they're high risk, like an Angelina Jolie, if they're gene positive, like for the BRCA1 or 2, then we tend to screen those women every year with an MRI rather than the ultrasound. It takes the place of the ultrasound. It's much more expensive. It's much more inconvenient, but it is extremely accurate. But for the average risk woman, which clearly you were, no family history, that we needed to, it was logical that we started with the ultrasound. But then we get this, surprise that you have a hidden cancer and you have these dense breasts, so maybe we should go. And not everybody would do that, but I think you were very cooperative and we gave you the option. And to our surprise, you had a second suspicious lesion. So we weren't able to see that one on the ultrasound, so we had to do, an MRI? MRI guided biopsy. So what was the experience with the MRI guided biopsy? There's where you go into a tube and they have to visualize this spot and then put a needle in and take out some tissue?
They did a needle guided biopsy on the right side.
Right.
And, you want them to find anything and everything that's possible. So it's a little scary, but you do what you need to do. You
didn't find it, say, compared to the ultrasound on the left, which was really kind of a piece of cake biopsy. Would you say that it was really pretty easy for you, or how would you?
The MRI and the right one?
No, I'm thinking how you compare the left one, which was an ultrasound guided, which was pretty easy in general, versus the MRI where you're in a tube and moving back and forth, and it's a lot of complexity.
Yes.
But did you find them one much easier than the other, or did they both seem about?
Well, I'm claustrophobic, so being in the MRI tube is a bit of a challenge for me. So we had to redo one of them because of movement. But it was a little bit more difficult, I think, the MRI.
But I think you just geared up for it, and you said, it was in your best interest to do it.
There was no question that I was not going to do it. I was going to do any test and every test that was recommended to find out if there's anything, that was missed. I did not want anything missed.
This is the attitude that saves lives. This is the kind of attitude that really gives us the option to give women the ultimate benefit of our imaging. And so the tragedy is that many women aren't getting their mammograms. There's now a law coming out from the government saying that they're not going to even pay for mammograms for women in their 40s. These are the women that are most commonly have the dense breasts. And so we know that if we can get women to get their basic imaging, do the extra screening if they have dense breasts, we're going to catch cancers, as we did in you, that are very small, stage 1 breast cancer on either side, and you have a superb prognosis. The overwhelming probability is that you're cured. But had we not gotten that ultrasound and then not gotten the MRI, things could have been much different. So it's a great story. I think that if women were, rather than look at the rules and the regulations, just think of Donna's story. Here's a woman who's completely asymptomatic, no family history. The only risk factor we identified is a mammogram showing fairly extreme density. We give her the option. I think you found it relatively easy to do the screening ultrasound, relatively pain-free. There was a spot. We put a needle into it. In this case, even an extra lesson, because there has to be coordination between the biopsy doctor and the doctor that read the initial mammogram, which is something we do very carefully at our center. And then in cases where they're unusual, adding an MRI, and particularly in high-risk women, the MRI is the ideal way of screening beyond, in addition to the yearly mammogram. So I think Donna makes an incredible contribution in making her story public and sharing with the viewers that, that when you do have dense breasts, you have to look in more detail. You have to recognize the mammogram has its limitations. And if there's any, for most women, we would consider adding a screening ultrasound yearly. For women who are at high risk, then we would screen with the MRI plus the mammogram. So Donna, thank you for sharing your story.
You're welcome.
I appreciate it. I think it's going to open a lot of women's eyes, and I think you're the ideal person. You've really done well, and it's good to see you looking so healthy and well after.
Thank you. Thank you. And thank you for your great care.
You're very welcome. Thank you.